University is going to be talking about equine metabolic syndrome for us. He actually started practicing way over the big blue ocean in England. He went to the University of Bristol, and from there practiced at the Dartmoor National Park, where the Dartmoor pony came from. And then he came here 23 years ago and started practicing at Cornell. He was at Cornell for 9 years before he came to the University of Wisconsin. And he currently works in the large animal internal medicine department at the university. No further ado, here we are.
So it's a pleasure to be here. It's wonderful to see this many people for a talk on a Saturday evening in the middle of winter on horses. It's great. I'd also like to offer my thanks to Dean Hingemeyer in the audience, because he really helped me out this week with a case in the clinic. So he does a lot of work for us too. He's a fantastic farrier. So I'm going to be talking about equine metabolic syndrome, which, if I went back 10 years ago, wouldn't even be a term that anybody knew about. It wasn't a disease that even had a definition at that time, although veterinarians and horse owners and farriers for a very long period of time, certainly prior to 10 years ago, knew that certain over-conditioned, easy-keeping horses and ponies in particular would suffer terribly with laminitis. Principally, as I said, ponies, but not limited to that particular type of horse. So a lot of what I'm going to be talking about tonight is relatively new, really describing a syndrome that we're still learning about. There aren't necessarily perfect answers to all the questions that come up. So to begin with a little bit of background, as I said, and I put it in quotation marks there, it wasn't discovered until 2002. So what we've really done since that time is use the term metabolic syndrome and borrowed it from human medicine. Human medicine has got all sorts of criteria for defining metabolic syndrome. Many of the human patients that are characterized as having that are type 2 diabetics, and there are some similarities between type 2 diabetes in humans and some of the horses that suffer and ponies that suffer from this condition. There are also people that have tremendous predisposition to certain forms of cardiovascular disease and stroke and things like that. As I said, the association between obesity and laminitis has been known about for a very long time, and we're just beginning to find out a little bit more about the pathophysiology and how those two things can be related. There is a lot of information, both professionally as veterinarians, but also in the horse industry on this. If you did an internet search and put equine metabolic syndrome in the search engine, you'd find an awful lot about it. I've put a web address there, and at the end of my talk, the very last slide, and I'll leave it up there for a few minutes, has got 2 or 3 links that you could copy down or you could come up and get afterwards that really provide a lot of very good summary information on the condition and some helpful things about things like body condition scoring, so that people can use that should they believe their horse or pony has that problem, and then you can continue to use that over the weeks, months, and years to come. But there is, there was, I should say, in 2010, a consensus statement released by the specialist group that I'm a part of, which is the American College of Veterinary Internal Medicine. It has a lot of technical information, a lot of veterinary information in it, but it is really pretty much the seminal article on this particular syndrome, and it's available to the public. It's not just for those people who are a member of that organization. So what are the principal clinical components of equine metabolic syndrome? The biggest parts of what we see clinically, on the left-hand side there, I put in sort of a pale red, and forgive me if it doesn't show up too well at the back, but increased adiposity, which basically is a polite way of saying big fat deposits in various areas of their body, laminitis, and what we refer to as insulin resistance, which again is a term that may not mean a huge amount to everybody in the audience, but it is something we borrowed again from human medicine. What tends to happen with these horses is that and ponies, that they are insulin resistant in that they don't handle glucose metabolism normally. Their insulin levels very often in their bloodstream, as measured by veterinarians, are extremely high, and very often their blood sugars are very, very high. They have abnormalities in how they deal with glucose, and inevitably, through very circuitous routes, that leads them to having problems with their feet and the laminar attachments between the coffin bone and the hoof wall. And that's one of the reasons why they're so much more predisposed to laminitis. There are a number of other things that we see as veterinarians, which you may or may not appreciate as an owner, but some things that certainly we can check when we're doing blood work, when we're evaluating responses to treatment, when we're monitoring these horses and ponies over the months and years. They have, like humans with metabolic syndrome, abnormalities of lipid, so fat metabolism. So they also have high levels of triglycerides. I'm sure many people in the audience, like myself, struggle with that particular problem and are periodically checked. And that also happens in horses, or in these particular types of horses. Some of them also have elevated blood pressures, for reasons we're not too sure about, particularly in the summer. We don't tend to think of blood pressure and high blood pressure as a problem in veterinary species in general. We don't take blood pressures in the way that human physicians and nurses do on most of our patients. But we're finding out that an awful lot of these horses and ponies, particularly in certain times of the year, are actually hypertensive. They have very high blood pressures. And that doesn't help them, particularly from the point of view of their laminitis. If they happen to be a mare, they also often have unusual reproductive cycling. And this is something that the owners may notice. You won't, of course, notice if they've got high blood pressure. There's nothing you can see on the outside of that pony or horse that tells you that the animal's blood pressure is elevated. There's nothing that tells you that they have high levels of triglycerides. But you can sometimes tell when it comes to things like reproductive cycling in a mare. Classically, mares with this particular problem continue, rather peculiarly, they continue to cycle during the winter. So they don't go through what we normally call seasonal anestrus. Horses are daylight length breeders, they're seasonally polyestrous, which means spring and summer they're cycling, typically, unless they're under lights, winter through to the early part of the spring, depending on whereabouts in the United States you live, they don't cycle. Mares with this particular condition will tend to cycle during the winter. When it comes to the spring and summer, when they're supposed to be cycling normally on that 3-week schedule, very often they have very long intervals. So they may go 6 weeks or 8 weeks or 9 weeks. There are other explanations why mares will not cycle normally. Don't think that every pony mare or every mare of any breed that doesn't cycle normally has this condition. However, that is one of the things that you see in females with EMS. What types of horses are most predisposed to the condition? There are certainly breeds in which we see it more commonly, and then there are breeds in which we see it very, very rarely. Most commonly, ponies, Morgans, Pasafinos, Arabians, saddlebreds, and particularly Spanish Mustangs, which of course are not that common. The Morgan breed seems to be particularly affected by it, but as I said, unfortunately, from where I'm from in England, the Dartmoor ponies are particularly affected with it, as are Shetland ponies, as are every other type of pony. The other light horse breeds, quarter horses, Tennessee walking horses, less commonly so, but we certainly see the condition in them. And it appears to be very rare in thoroughbreds and standardbreds. And it's rare in draft horses too, although I have seen it in some draft horses. Miniature horses and donkeys, we don't know if it happens in them, we think not. Most people, I'm sure, who've ever seen miniature horses, probably the first thing, if you don't actually have them, and I'm not trying to be rude about them, my wife has them, miniature horses are often fat. That's not an uncommon finding. Cassie and Connie will probably tell you that at various times during my lectures I sometimes show a picture of a morbidly obese miniature, which is my wife's favorite older mare. So it doesn't always pay to be the animal of a veterinarian. We don't think this condition per se happens in miniature horses. That is not to say that they don't get fat. And sometimes, unfortunately, also get laminitis. But this particular explanation for that problem does not appear to happen in minis or in donkeys. The biggest thing that we fear with a number of diseases in horses is sometimes not the specific disease itself, but the sequelae or the consequences. And with EMS, everybody I think in the audience would agree, you can tolerate to look at a fat horse. You can tolerate to look at a horse that looks a bit obese, and the horse can tolerate it pretty well too. They don't have a bad personal self-image as a consequence of it. But the thing that we really fear with this disease is its very strong association with laminitis.